The useful thing about having access to the guidelines as a provider is to be able to speak the same language with the payer, because that's unfortunately, and here I'm speaking as a physician. When I went to medical school residency, nobody talked about any of this stuff. We had no classes on utilization management. Nobody told me that one day there would be another doctor who would say, no, what you want to do, you shouldn't be doing. And if you do it, we're not going to pay for it. And it can sometimes be kind of baffling, because in your head, it's you've made the decision to admit or do the test or administer the treatment. So in your head, it makes sense, right? I mean, in your head, it's perfectly justified. Otherwise, you wouldn't be doing it because you're a good doctor. And then to have somebody else disagree with you, it obviously brings up the question, why? Why are you disagreeing with me? Are you calling me? And I think that's where some doctors can get kind of defensive, where you're saying that I'm practicing, the wrong way. And if that's the case, why are you saying that? And having access to the guidelines, it's again that issue of transparency, right? I mean, you can see exactly where the payer is coming from, and you're speaking the same language. Not only about the decision-making aspect of it, but also appropriate patient care, right? Because those are two separate questions. One is what is the appropriate level of care for a certain patient, or what is the appropriate treatment for a certain patient. That's one question. But the other is, once that patient admits to the hospital, say, you made the utilization management decision that this admission is justified and you're going to pay for it. What are you supposed to do with that patient? What are the best practices, right? I mean, in terms of what treatments are evidence-based. And I think we do have a whole section in each of our guidelines about care planning, with all the things that you're supposed, or ideally, if you do them, you're following best practices in terms of what is evidence-based, what has been shown to work. So I think that aspect is also valuable for the same reason as I mentioned in the pairs, that it's a flood of information. A lot of it is low quality, and we do the work. We sift through it, and we put what we think is important and is relevant. And so having access to that information just makes life easier.